If you have noticed an unusual smell coming from your body that was never there before, if your breath has taken on an odor that mouthwash cannot fix, or if you or someone close to you has detected a strange scent that seems to come from nowhere, I need you to stay with me for the next several minutes because what I am about to share could help you catch something serious before it becomes too late. This is not meant to alarm you unnecessarily. This is meant to inform you about warning signs that your body produces when something is going wrong internally. Warning signs that most people dismiss, ignore, or try to cover up without ever asking why they appeared in the first place. Your body has remarkable ways of communicating with you, and unusual odors are one of the earliest signals that something may be seriously wrong inside. The tragedy is that most people never learn what these odors mean until after a diagnosis, when they look back and realize the warning was there all along. Let me make you a clear promise right now. By the end of this video, you will understand 3 specific body odors that have been linked to cancer in seniors. You will know exactly why each odor develops, what it indicates about your internal health, and most importantly, when to take action. This is not about creating fear. This is about giving you knowledge that could save your life through early detection. I am Dr. James Mitchell. I have spent over 25 years working with patients facing serious health challenges, and one pattern I have observed repeatedly is how often the body sends warning signals that get overlooked. Patients tell me they noticed something was different months before their diagnosis, a smell, a sensation, a change they could not explain, but they dismissed it because they did not know it could mean something important. Cancer, when caught early, is often treatable. When caught late, it becomes much more difficult to address. The difference between early and late detection can be measured in years of life. That is why warning signs matter so much. That is why I am sharing this information with you today. So let me ask you directly, have you noticed any unusual odors from your body that you cannot explain? Has your breath changed in a way that seems different from normal bad breath? Write your answer in the comments below, because recognizing these patterns is the first step toward protecting yourself. Let me tell you about a man named William. William was 72 years old and had always taken good care of himself. He exercised regularly, ate reasonably well, and had no major health complaints. But over the course of several months, his wife began noticing something strange. She said William's breath had changed. It was not the typical morning breath or the smell after eating certain foods. It was something different, a sweetish, almost fruity odor that seemed to linger throughout the day regardless of brushing or mouthwash. William dismissed it. He figured maybe he needed to see a dentist or perhaps change his diet. His wife kept mentioning it and he kept ignoring her concerns. It was just breath after all. How could that be anything serious? 6 months later, William was diagnosed with pancreatic cancer. When his oncologist explained the disease, William's wife asked about the breath odor. The doctor told her that certain cancers change the body's metabolism in ways that produce distinctive smells. The odor she had detected was actually a warning sign. William often said afterward that he wished he had taken his wife's observation seriously. Those months of ignoring the warning could have been months of treatment. He always wondered if earlier detection might have changed his outcome. I share William's story not to frighten you, but to illustrate how important these signals can be. The body often knows something is wrong before we feel sick in obvious ways. Odor changes are one of the earliest manifestations of internal disease. Here is what I need you to understand before I explain each of the 3 warning odors. Cancer changes your body's metabolism. Tumors consume energy differently than normal cells. They produce waste products that normal cells do not. These metabolic changes create compounds that eventually make their way into your breath, your sweat, your urine, and other bodily secretions. Scientists have actually trained dogs to detect cancer through smell because the metabolic signature of cancer produces volatile organic compounds that can be identified. Research facilities are developing electronic noses that can screen for cancer through breath analysis. The science behind odor detection of disease is real and advancing rapidly. What I am sharing with you today is based on this understanding. Certain odors suggest certain metabolic changes, and those changes can indicate serious disease, including cancer. Now let me walk you through the 3 specific body odors that seniors should never ignore. The first warning odor is a sweet or fruity smell on the breath that appears without explanation and persists over time. When I say sweet or fruity, I mean an odor similar to overripe fruit, nail polish remover, or what some people describe as a peculiar, almost chemical sweetness. This is not the pleasant sweetness of candy or dessert. It has an off quality that people often find difficult to describe, but easy to recognize once they notice it. This type of breath odor can develop when tumors alter the way your body processes sugar and produces energy. Cancer cells are notorious for consuming glucose at extremely high rates. They use a different metabolic pathway than normal cells, and this produces byproducts including ketones and other volatile compounds that have sweet or fruity odors. Pancreatic cancer in particular is associated with this type of breath change because the pancreas regulates blood sugar. When a tumor affects pancreatic function, metabolic disruption follows and breath odor changes can result. Lung cancer has also been connected to distinctive breath odors. The lungs are obviously directly connected to the breath, and tumors growing in lung tissue can release compounds directly into exhaled air. Liver cancer and cancers that have spread to the liver also alter metabolism in ways that can produce unusual breath odors. The liver is your body's primary metabolic processing center. When it is compromised by disease, waste products accumulate and some escape through the breath. Let me be clear about something important. Sweet breath can also indicate diabetes or diabetic ketoacidosis, which is a medical emergency unrelated to cancer. If you notice a sudden onset of sweet or fruity breath, you should seek medical attention promptly regardless of the cause. Something significant is happening in your body, and it needs evaluation. The key with cancer-related breath change is that it tends to develop gradually, persists over weeks and months, and does not respond to typical remedies like better oral hygiene or dietary changes. If you or someone close to you notices this type of odor appearing and persisting, please bring it to your doctor's attention. Mention it specifically. Ask for it to be taken seriously. Now let me tell you about the second warning odor, and this is the one I particularly urge you not to ignore. The second warning odor is a foul or fecal smell on the breath that seems to come from deep inside the body. This is an odor that disturbs people greatly when they notice it. It smells like something rotting or decaying. Some describe it as similar to sewage or waste. It is distinctly unpleasant and different from ordinary bad breath caused by food or oral hygiene issues. This odor is particularly concerning because it often indicates obstruction or malfunction in the digestive tract. And one of the most common causes of such obstruction in seniors is colorectal cancer. Colorectal cancer is the second leading cause of cancer death when men and women are combined. It develops slowly over years, often beginning as benign polyps that gradually become malignant. By the time symptoms become obvious, the cancer has often advanced significantly. Here is why this odor develops. When a tumor grows large enough to partially block the intestines, waste material cannot pass through normally. It accumulates, ferments, and produces gases that are absorbed into the bloodstream and eventually exhaled through the lungs. The result is breath that smells like the digestive waste that is trapped inside. Additionally, some gastrointestinal cancers, including stomach cancer and esophageal cancer, can cause foul breath as tumors grow, ulcerate, and produce waste products directly in the upper digestive tract. I want to tell you about a patient named Margaret. She was 68 years old and had been noticing occasional foul breath that she could not explain. Her daughter mentioned it gently several times. Margaret felt embarrassed and started avoiding close contact with family members. She tried stronger mouthwash. She brushed more frequently. She chewed gum constantly. Nothing worked because the odor was not coming from her mouth. It was coming from deep inside her body. Margaret finally mentioned the problem to her doctor during a routine visit. She almost did not bring it up because she felt foolish complaining about bad breath, but something made her mention it. Her doctor took it seriously and ordered a colonoscopy. They found a significant tumor in her colon that was partially blocking her intestines. The cancer had not yet spread to lymph nodes or other organs. Margaret had surgery, received treatment, and is alive and well today, 5 years later. Margaret believes that mentioning her breath odor saved her life. If she had continued to ignore it or feel too embarrassed to bring it up, the cancer would have continued growing. By the time she experienced more obvious symptoms like pain, bleeding, or severe constipation, the cancer might have spread beyond effective treatment. This is why I emphasize the second warning odor so strongly. It is often dismissed as merely embarrassing rather than medically significant. People try to cover it up rather than investigate it. And colorectal cancer is highly treatable when caught early, but often fatal when caught late. If you have persistent foul breath that does not respond to oral hygiene measures, please see a doctor. Request evaluation of your digestive system. Do not let embarrassment prevent you from potentially life-saving early detection. Now let me explain the third warning odor you need to know about. The third warning odor is an ammonia or bleach-like smell that appears in urine, sweat, or breath. This is a sharp chemical odor similar to household cleaning products. Some people describe it as smelling like a swimming pool or like strong cleaning ammonia. It is distinctly different from normal body odors and tends to be quite noticeable. This odor develops when waste products that should be eliminated by the kidneys or processed by the liver begin accumulating in the body. The smell is actually the chemical ammonia which is produced when protein is broken down, and which should normally be converted to urea and excreted efficiently. Kidney cancer can produce this odor as tumors impair kidney function. The kidneys filter waste from the blood, and when they are compromised, ammonia and other waste products build up and exit through whatever route they can, including the sweat glands and the breath. Liver cancer similarly can cause ammonia odor, because the liver is responsible for converting toxic ammonia into harmless urea. When liver function is impaired by tumor growth, ammonia levels in the blood rise and the smell becomes noticeable. Bladder cancer can also produce unusual urine odors as tumors grow, bleed, or become infected within the urinary tract. Let me tell you about a man named Robert. He was 75 years old and began noticing that his urine had a very strong ammonia smell that was different from normal. He also noticed that sometimes his sweat seemed to have an unusual chemical odor, particularly after exertion. Robert assumed it was related to dehydration. He tried drinking more water. The smell persisted. He figured maybe it was a medication side effect. He checked with his pharmacist, who said none of his medications typically caused that. Finally, Robert mentioned it to his doctor during an appointment for something else entirely. His doctor ordered blood tests and urinalysis. The results showed abnormal kidney function. Further imaging revealed a mass on his kidney. Robert had surgery to remove the affected kidney. The cancer was contained. He is now monitored regularly but living a normal life. Robert told me he almost never mentioned the odor. He thought it was trivial. He thought he was being hypochondriac. But that trivial observation led to the discovery of cancer at a stage when it could still be completely removed. Now I want to explain something important about why these odors develop and what they tell us about cancer biology. Cancer cells have what scientists call altered metabolism. Normal cells produce energy primarily through a process that requires oxygen and produces carbon dioxide and water as byproducts. These byproducts are odorless and easily eliminated. Cancer cells often rely on different energy production pathways. They ferment glucose even when oxygen is available. This produces lactic acid and other compounds as byproducts. They break down amino acids and fats in unusual ways. They produce volatile organic compounds that healthy cells do not generate. These metabolic byproducts enter the bloodstream. From there, they travel to the lungs, where some are exhaled. They travel to the kidneys, where some enter the urine. They travel to the skin, where some are released in sweat. The specific byproducts produced depend on the type of cancer, its location, and how it is affecting surrounding tissues. Different cancers tend to produce somewhat different odor signatures. This is why researchers believe breath and odor analysis could eventually become valuable screening tools. What I want you to take away from this is that unusual odors are not random. They are not imaginary. They are the chemical signature of metabolic changes happening inside your body. When those odors appear without explanation and persist over time, they deserve investigation. Now let me give you practical guidance about what to do with this information. First, pay attention to your own body odors. This might seem like strange advice, but most people try to ignore or cover up odors rather than noticing them. Ask yourself regularly if anything has changed. Does your breath smell different than it used to? Does your urine have an unusual odor? Does your sweat smell strange? Second, ask trusted family members or close friends if they have noticed anything. People who live with you may detect odors that you have become accustomed to and no longer notice yourself. Give them permission to tell you honestly if they smell something unusual. This is not criticism. It is potentially life-saving information. Third, if you or someone else notices an unusual, persistent odor, bring it to your doctor's attention. I cannot emphasize this enough. Do not feel embarrassed. Do not feel like you are wasting their time. Explain exactly what you have noticed, when it started, and how it has changed. Fourth, do not assume an unusual odor has a benign explanation without verification. Yes, changes in diet can alter body odor. Yes, some medications cause unusual smells. Yes, certain foods cause temporary breath changes. But if an odor persists without clear explanation, it deserves evaluation. Fifth, if your doctor dismisses your concerns without investigation, advocate for yourself. Ask specifically about the connection between odor changes and internal disease. Request appropriate testing. Seek a second opinion if necessary. Your intuition that something is wrong may be based on real biochemical signals from your body. Let me tell you one more story because it illustrates the power of paying attention. A woman named Elizabeth was 70 years old and had always been attentive to her health. She noticed that her breath had developed an unusual quality that she could not quite define. It was not overtly unpleasant, but it was different. Her husband confirmed he noticed something too. Elizabeth mentioned it at her next doctor's appointment, even though she felt somewhat foolish. Her doctor was initially dismissive, but Elizabeth insisted something had changed. The doctor ordered basic blood work, which came back slightly abnormal. This led to further testing, which revealed early-stage lung cancer. Elizabeth's cancer was treated successfully. She often credits her survival to paying attention to that subtle change and refusing to be dismissed. Early detection of cancer dramatically improves outcomes. The 5-year survival rate for many cancers is vastly different between early and late-stage diagnosis. A cancer caught at stage 1 may have survival rates above 90%. The same cancer caught at stage 4 may have survival rates in single digits. This is why warning signs matter so much. This is why I am sharing this information despite the discomfort of the topic. I would rather discuss body odor honestly than have patients miss early warning signs that could have saved their lives. Now let me address some important caveats because I want to be completely clear with you. Having an unusual body odor does not mean you have cancer. There are many benign explanations for changes in breath, urine, or sweat odor. Infections, dietary changes, medication effects, liver or kidney conditions that are not cancer, diabetes, and other factors can all cause unusual smells. The purpose of this video is not to make you assume the worst. It is to make you aware that persistent, unexplained odor changes deserve medical evaluation. Most of the time, that evaluation will reveal something benign and easily addressed. But occasionally, it will reveal something serious that needs immediate attention. The goal is early detection. The goal is not panic. Also understand that not all cancers produce noticeable odors. Many cancers develop without any odor change at all. Regular screening and preventive care remain essential, regardless of whether you notice any warning signs. Finally, remember that modern medicine has many tools for detecting and treating cancer. If you are evaluated and something concerning is found, there are options. There are treatments. There are paths forward. Knowing is always better than not knowing. Here is what I want you to remember from this video. Your body communicates with you constantly. Unusual, persistent odors are one form of that communication. Sweet or fruity breath can signal metabolic disruption from several cancers. Foul or fecal breath can indicate digestive tract obstruction or malignancy. Ammonia or chemical odors can suggest kidney or liver involvement. Pay attention to these signals. Do not ignore them out of embarrassment or assumption that they are trivial. Bring them to medical attention promptly. Advocate for thorough evaluation. Early detection saves lives. It is truly that simple. I have seen patients whose cancers were caught early enough to cure because they or their loved ones noticed something had changed and took it seriously. I have also seen patients whose cancers were caught too late because warning signs were dismissed as aging or embarrassment or imagination. You have the power to be in the first group. You have the power to notice, to investigate, and to catch problems early. If this information was valuable to you, please share it with the seniors in your life. Share it with your parents, your siblings, your friends, your neighbors. The more people who understand these warning signs, the more lives can potentially be saved. And if you want more information about protecting your health as you age, subscribe to this channel. I have much more to share with you about early warning signs, prevention strategies, and health optimization. Thank you for watching. This is Dr. James Mitchell. Pay attention to your body because it is always trying to tell you something important.